My name is Pete Tomasek. I'm from Powell, Ohio. I've had a good deal of pain for about 17 years before I had this procedure.
Mr. Tomasek came to me as somebody who'd really been having problems for years. He had had a very bad ankle injury in an accident and had developed arthritis.
It was very difficult to walk or to be on my feet for even an hour at a time. It was becoming increasingly difficult to ride my Harley. I ended up at OhioHealth for my ankle replacement because of Dr. Burlett.
Our surgical options really were two. We could fuse it, which means we take the two bone ends and we pull them together, or we could replace the joint. Given his problem, his goals, and the way that he had thought through it, I thought it was very reasonable that we do a joint replacement.
For me, it was a no-brainer. I was confident in the research I had done. I was confident in the doctor and confident in the device.
What Prophecy is a technique where I can do a virtual surgery ahead of time. It makes the operation much more predictable. It makes the surgery faster, so the patient's under anesthesia less, which makes it much safer. We need a CAT scan. What the CAT scan does is it helps us look at their anatomy in 3D. That is then imported into a computer system which creates models which are identical replications of their bones. At that point then, the surgery is done virtually, positioning the implants where they need to be, which generates patient-specific guides which come with the patient to the operating room. So on the day of surgery, what's different is the instruments that are used to put the implant in are highly accurate and are individualized for that specific patient.
I had total confidence in Dr. Burlett, and he didn't let me down. Nor did his staff. Everyone there at the hospital was tremendous.
The healthcare team is really the unsung heroes. A lot of times the physician will be the one up front, but what's behind him is a tremendous team that makes it all flow. Ultimately, we'll see each other every year to two, probably for the rest of his life. Last time we were together, we talked about the kids and the family because the ankle was doing well, but we also talked about him riding his motorcycle, back to traveling, enjoying his day-to-day activities, not taking any medication.
Nowadays, after my ankle replacement, I'm able to take my dog for a walk and stay out there until my dog is tired, not until the pain in my ankle makes me need to get home. After I got back on the bike, it was a whole new feeling of freedom. It was what I recalled from before the accident. The pain is gone. The constant ache, day in and day out. The stiffness when I woke up in the morning, all gone. It's just wonderful.